Welcome to Somali Magazine. It's a great pleasure to have Professor MohamedJamaSalad, Head and Professor of Neurosurgery, Department of Medical Regional Hospital at Galkayo University Hospital. He is also Chairman of Board of Directors of Puntland University of Sciences and Technology in Galkayo in Puntland, State of Somalia. Welcome to the program.
Thank you.
One of the objectives of this program is to show the world that the Somali people have their own intellectuals on international level, and you are one of them. Can you tell us your background, please?
I have studied in Somalia until the secondary school level, and then I had a scholarship from the Italian government in 1964, and I have graduated from the medical school of Bologna University in Italy. Then I attended the postgraduate course in neurosurgery at the University of Turin, also in Italy. At this time I was working at the department, one of the famous departments of neurosurgery in Italy, the first department of neurosurgery of Ospedale Bellaria in Bologna. One of my teachers or professors, Professor Fabio Columella and Professor Giovanni Ruggero, they were pioneers in their fields, in neurosurgery and in neuroradiology. In 1980, they called me in Somalia as a professor, associate professor at the Faculty of Medicine at the National University of Somalia, where I began to build a department of neurosurgery and neurophysiology and neurology, and that was the Institute of Neuroscience of the Faculty of Medicine in Mogadishu. We have trained many junior Somali doctors in the field of neurosurgery and neurology. But in 1990, the civil war, in the abrupt of the civil war, all these programs that we have created in Somalia just collapsed. And then I went back to Italy, and I became professor at Tor Vergata University, professor of neurotraumatology, and at the same time the head of the Department of Neurosurgery at Aurelia Hospital in Rome. In the year 2000, I decided to back home because in 1998, Puntland State of Somalia was established, and I made I visited Puntland, and I saw that I can trust, and there was peace, and the administration has regained it. And I began with others the Department of Neurosurgery there. Year after year, the department and the hospital, the Muduk Regional Hospital, that will become later the University Hospital. At that time, we also began to build up Puntland State University, 2 campuses, one campus in Garowe, and another one campus in Galkayo, with Faculty of Medicine, Engineering, and so on. Then we have also sustained and give a hand to the Ministry of Health in Puntland. So today we can say that the Ministry of Health in Puntland is going and is building up all the facilities of health in Puntland state.
You are here in Denmark and you are going to Sweden a few days. What was the purpose of your trip to Europe?
The purpose of my trip in Europe is 1 week ago I was in London where I meet friends, my best friends, and also some relatives and some people from Puntland, and just going around to see what they can do and if they can come back to Somalia, because the situation I think now in Somalia is better than years ago.
Yeah.
And there is a great need to tackle the brain drainage that has been in Somalia.
That is the really worst thing to happen in Somalia and generally in Africa, where all the intellectuals are just running away, to Europe, to other countries.
Yeah.
And that's good, if you just talk to them and they may come back if they see the way you are doing and what you are doing now.
Yeah. Yeah.
So that's really good. I mean, you have been a pioneer and model for the Somali people in the health development for many years, but it didn't come without struggle. I know that. What are the main barriers you encounter through your work in Somalia, especially Puntland area? What are the for hindering and all the barriers you just observe through your struggle?
I think we can divide the problems in main problems and secondary problems. The main problem is that I have seen in Somalia, especially in Puntland, is that the brain drainage caused within the state and within the Somalia in the 90s was, or before the 90s, was an example state for all Africa. Somalia had the biggest number of intellectuals, doctors, engineers, and so on and so on. And the National University of Somalia, Somali National University, was an example for all Africa. If you remember that the WHO and the international organizations recognized the Somali National University as an example for all Africa. And even I remember in 1985, when the United Arab Emirates decided to implement a faculty of medicine in Al Ain, they came to Mogadishu and they asked to the Ministry of Education, of Higher Education of Somalia, at that time, Dr. Ahmed Ashkir Botan, to give him teachers for their university.
Okay, they are asking cooperation.
Cooperation, yeah.
Yeah.
At this time, Somalia had implemented, for example, a cooperation and trained Angola forces.
And all that.
And all that disappeared.
Yeah.
Was destroyed by the civil war.
Yeah. But the barriers that you just observe in relation to the work you are doing, what are the main obstacles that you observe?
Main obstacles we have seen now, yeah. the main obstacles that we have seen now is the lack of instruments, the lack of know-how. This is the big problem that Somalia is facing now.
Yeah, that's the problem. We have the resource.
We have the resources.
Yeah, and people are coming back from everywhere.
People are coming back, and also I saw day after day the people that are graduating from the schools, from the high schools. I remember in the year 2000, when I went back to Puntland, the high schools were few. There was a few high schools with few students. Today, only in Galkayo, there are 10 high schools.
10 high schools?
10 high schools.
Incredible.
Only in Galkayo.
Yeah.
2 universities. So this is, and the elementary schools has been implemented even in the smallest village.
Mm.
You can find the elementary school and the intermediate school.
That means the people are just rebuilding the country through education and that.
Yeah.
But that's really good. But as you said, Somalia have been there was not an effective government in Somalia, nearly more than 2 decades, you know, and because of the war and everything is collapsed, as you said. Can you give us brief idea about the status of the health status in Somalia now? How is it?
Yeah, that's an interesting thing. Somalia, before the year 93, before the year 97, the health sector was inexistent. But in Puntland and Somaliland, something began. And they began to build up the health sector, beginning from the ministry levels, regional level, district level, and to the small village level. Today, you can find in Puntland health posts in the smallest villages, MCH, mother and child health centers, and the district hospitals and the regional hospitals. So all functioning. And also there is immunization campaigns that the government of Puntland and Somaliland are providing to immunize their children against polio, against all
other types of
other types, there are 6
diseases.
types of immunization.
Yeah.
And this is very interesting. Also, you can find, for example, TB centers.
Oh, yeah.
And these TB centers, for example, there is a TB center in Bosaso, another one in Gardo, in Baran, Garowe, Galkayo, and Galdogob. Also, the Ministry of Health of Puntland is supporting the TB center of in Galgaduud. And there is many people that are coming from abroad, for example, especially young doctors.
Yeah.
They are graduating from China and Sudan.
Yeah.
And
well educated, and they come back to.
They are coming back. Yeah.
Yeah.
Today, 54% of the manpower of the ministry, the Central Ministry of Health, are women.
Yeah.
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 But that's really good.
That is
That's nice, you know, to see.
Yeah.
Because sometimes I hear the people in Africa and Muslim countries, they just, you know, they don't accept women involved in the system, and they segregate women and all that. But now I can see women are taking
if you
good
come
part.
to the headquarters of the Ministry of Health in Garowe, you can see 54% of the personnel are women.
Yeah.
Yeah.
But that's really good. You are talking Malaya. In Denmark and other countries, Western countries, they just eradicate, you know, malaria,
TB and malaria.
TB.
Yeah.
Malaria is just really, it comes sometimes when some people have been in tropical countries.
Yeah.
But in relation to TB, they just eradicate large part of the world, you know, large part of Western countries.
Yeah.
What about the future in Somalia in relation to TB? Because some people suffer that.
It's very difficult because the problem in the past was that the medicines was prescribed to the patient, and the patient was going home with the prescription. And when he feels well, after 1 month, 2 months, he was deciding to not get the medicines. That was the problem that we have discovered. Mm. Now, in Somalia, we had got the DOT system. That means every patient, TB patient, go to the center in the morning, and the center give him the medicines with a small
breakfast.
Breakfast.
Yeah.
Yeah.
But that's good, you know, they get the food,
they get
breakfast.
the breakfast and the medicine.
That's the side
yeah,
effect of that.
Yeah, they come, and so they come to every morning there.
Yeah.
Yeah.
But that's really a good idea.
And
you know,
also in Puntland, the Ministry of Health of Puntland has decided with a decree that no pharmacist can sell the TB drugs.
Okay.
And the TB drugs are only distributed in the TB centers freely.
Mm. Good system. What I'm thinking, you know, according to World Health Organization, there are some form of mental illness.
Yeah.
Nearly, really 10% of the people in the world's population are affected by mental illness. Somalia is not exception, you know, an exception.
Yeah.
What's the situation in Somalia in that regards?
In the situation of mental health in Somalia, it is neglected. It's really is neglected because now we are beginning to put the mental health in the basic PHC or primary health care. And some centers, for example in Puntland and in Somaliland, arose, and there is some of them, they are not public. For example, in Puntland, only 2 centers are public. The center in Garowe and in Gardo are run by community level, not by the government. Also in Somaliland, the center of Hargeisa is run by the government, but the center also in Burao, but there are other centers not run by the government, but by the communities.
Yeah. Okay. So it needs.
So there is a
More
great
efforts.
need. There is a great need of mental health centers.
There are some hospitals or some places where we use that for that in Puntland area.
Bosaso, there is the center, the mental health center of the General Hospital of Bandar Qasim in Bosaso. Also in Galkayo, there is the mental health center. And all in Garowe, there is a mental health hospital.
Yeah.
In Gardo and in Baran.
That's two places. That's good for the society there. What I'm thinking is that, as you told me before, child mortality is very high in Somalia, as well as so many women die, when they are pregnant. That's not only in Somalia, but other places in Africa and other areas.
Not only in Africa
but
Somalia.
I was reading.
Somalia and Afghanistan are in the lowest level.
Yeah. They have the highest child
mortality.
Yeah. What's the situation now, progress in Somalia in relation to that?
The situation is improving in the last 3 years because we have implemented, for example, in Puntland, the child health maternity, MCH, maternity and child health centers. Not only, but we have decided to open special departments in the hospitals. For example, one of the leading departments is in the Mudug Regional Hospital.
Oh, yeah.
Yeah, and it is run by MSF Holland.
That you are cooperating with
MSF Holland, in this department there is an OPD. The OPD of the Department of Child Health. They visit every day about 200 children per day. And also it is attached to this department the TFC, Therapeutic Feeding Center. This Therapeutic Feeding Center is serving about 1,300 children.
Oh, yeah.
From all Somalia, especially from Galgaduud region, from the neighboring regions of Puntland, Galgaduud and Eastern Ethiopia. And it is very...
It's just developing.
We are proud of this collaboration.
Another way, you are doing so much.
Also, Also, there is the maternity department that now every month we have 200 children born in this department.
Oi.
Yeah.
That's great.
And that's great.
That's really great.
And they are performing a visit. They are performing a visit of the women going to see the women is about 40, 50 women per day.
Yeah.
Yeah.
It looks normal for a small part of the country. What I'm thinking, Somalia is a large country.
Yeah.
And very sparse. And relatively, the population are not relatively low. There are not so many populations in Somalia when you relate to the size of the country. And the people are enjoying their nomadic life,
Yeah.
What I'm thinking, how you reach these people, the nomadic, the nomads, the people are just, going with their life there. How you reach there?
The last year, the Ministry of Health of Puntland has decided to go to the nomadic people because our health services mainly are based in the big cities of Puntland. And the population of Puntland is about 65% are nomadic people.
65?
65%.
Yeah.
So the majority of the people cannot come to the hospitals. And the health services must go to them.
You have to be mobile.
You have to be mobile. We are going to set up mobile clinics that go to the nomadic people. That's the nomadic health system.
Yeah.
Yeah.
So you have to go there and just, you know, because they cannot come and they have to keep their animals and all that. What I'm thinking, you know, this is very extent, you know, it requires so much resources to reach these people, isn't it? Because you have to travel so many places in that area.
Yeah.
Where do you get all that, you know, resources from to reach the people?
Mostly we have collaboration with international agencies like WHO, UNICEF, and with many NGOs. For example, we have MSF Holland, we have Mercy Corps from USA, we have also Save the Children, UK, we have Merlin for UK also, we have many NGOs that are...
Many organizations are involved. Yeah. Okay, that's good. But I think Somalia needs more.
Yeah, we need
more. We need the world, you know. We
Yeah.
have been nearly in 20 years, more than 20 years, without government, without any system functioning
Without central
in
government,
Somalia. And then we need the world, you know. That's one of our best way to mention and tell the people in the world they have to come to Somalia and help.
I think that that is possible. And let me tell you some examples of cooperation that is going on in the Horn of Africa from the Scandinavian countries. For example, there is a neurosurgical training program between Ethiopia and Norway, Bergen University, that has succeeded. Ethiopia has in the past, they have no neurosurgeons. But the Norwegians decided to train, and now, today, Ethiopia has about 5-7 neurosurgeons.
Yeah.
This is one example of success.
Yeah.
And also, Sweden, for example, Göteborg Initiativet, or Göteborg Initiativet, it's one of the programs that has succeeded in Galkayo.
Yeah. But that's really nice. The time is running from us, you know. But I hope the Danish people, Aarhus, Count, and other European countries will hear what you are saying, because you are well recognized person in the world, you know, and they will cooperate with Somalia. That's what I'm saying. But thank you for coming. We are very delighted to have you here today. This program and the other programs that we had before, you can just watch in the internet or podcast from the internet, somaliportal.dk, and we put this program on YouTube, and then you can watch from there. The program will be sent on Friday, 4 o'clock here in Denmark, but you can, if you are staying other place in the world, you can just watch this program on the internet if you want that. Goodbye, and thank you for watching.
Thank you.
You're welcome.